Hello and welcome to Live Healthy Radio on WLIV, the only radio station that covers your important health issues. Today we're going to guide you on a blood pressure road trip with the topic hypertension, also known as high blood pressure. High blood pressure happens when the pressure in your arteries is higher than it should be. Did you know it's also known as the silent killer? That's because it may not have any signs or symptoms, and many people do not even know they have it. If high blood pressure is left untreated, it can lead to many problems that can affect different parts of the body. High blood pressure increases the risk of heart attack and stroke, as well as heart failure, kidney disease or failure, vision loss, damage to blood vessels, and more. The only way to know if you have high blood pressure is to get your blood pressure measured. By knowing your numbers, you can begin to take action for preventing or controlling it. Your blood pressure numbers can relate to a stoplight. Green is good, yellow is caution, and red is dangerous. Let's take a look at the following stoplights. As we come to a stop at each one, which color do your numbers fall under? For our first stop, green means good. This is where you want your blood pressure to be. Being in the green means that your numbers are less than 120 for the top, or systolic, number, and less than 80 for the bottom, or diastolic, number. If your blood pressure falls within the green zone, you are good to go and your blood pressure is currently controlled. For our second stop, yellow means caution. This means that your blood pressure is elevated. Being in the yellow means that your numbers fall between 120 and 129 for the top number and less than 80 for the bottom number. A blood pressure that falls between 130 and 139 for the top number, or between 80 and 89 for the bottom number, is considered high blood pressure. If your blood pressure is consistently 140 or higher for the top number, or 90 or higher for the bottom number, your doctor may prescribe a combination of medication and lifestyle changes. Don't ignore your blood pressure, waiting for a symptom to alert you of an issue. Remember, high blood pressure is known as the silent killer. For our final stop, red means danger. This means that your blood pressure is dangerously high and that you need urgent medical attention. Being in the red means that your numbers are greater than 180 for the top number and or greater than 120 for the bottom number. If your blood pressure falls within this range, contact your doctor immediately. If you are also experiencing symptoms when you are in the red zone, such as chest pain, shortness of breath, back pain, sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding, or sudden trouble seeing in one or both eyes, call 911 immediately. Knowing your numbers, combined with regular checkups, can help you control high blood pressure. Here are some tips for measuring your blood pressure at home. Blood pressure should be taken using the instructions included with your monitor, as well as directed by your doctor. Blood pressure should be measured and recorded twice daily at the same time each day, unless otherwise directed by your doctor. 2 measurements should be taken 1 minute apart every morning, and 2 measurements should be taken 1 minute apart every evening. You should share your blood pressure numbers with your doctor as directed. With the correct treatment, you can control your blood pressure to help you live a long and healthy life. Thanks for tuning in to Live Healthy Radio on WLIV. We hope that you learned a little more about high blood pressure today. Tune in for our next road trip guide to learn more about taking your blood pressure at home. For more information, please visit the American Heart Association or CDC websites.